So, this topic is about the science of obesity and behavioral intervention for weight management. Right? So, first we describe what is the obesity. Obesity is a major global public health concern. The rates of obesity have increased dramatically worldwide. It contributes to chronic diseases and reduce the quality of life. The effective managements require the scientific and behavioral understanding. So, in the basic cause of the obesity is the overnutrition, low physical activities, and genetic factor. But there is also some effects like insulin resistance, type 2 diabetes, cardiovascular disease, infertility, and several other immune responses. So, obesity is excess accumulation of body fat measured using the body mass index, which is the BMI. BMI is more than 30 kg per m squares, indicates the obesities, which recognized as a chronic relapsing disease. The effect on the obesity is basically on the metabolic syndrome risk factors like type 2 diabetes, cardiovascular disease, fatty liver disease, kidney disease, and the gallstones. There is also some direct effects such as the asthma, sleep apnea, obesity, hyperventilation syndromes, osteoarthritis, back pains, and the gut conditions. So, what is the energy balance? Weight can occur when energy intake exceeds the energy expenditures. High calories diet contribute to positive energy balance. Low physical activity reduce the calories burning, so long-term imbalance lead to the fat storage. There is some genetic factors like genetic influence the appetites and the metabolisms. Some individuals are predisposed to weight gain. Genes affect the fat distribution and energy use, so the environment interact with the genetic risk. There is some hormonal regulations like leptin signals fullness to the brain. Ghrelin stimulates the hunger. Insulin regulates the blood sugars and the fat storage, while hormonal imbalance can increase the appetite. There is a brain in the eating behavior. The hypothalamus regulates the hunger and satiety. The reward system drives the pleasures from the food. So highly palatable foods increase the dopamine release. Stress and emotion influence the eating patterns. There is some environmental influence like increased availability of fast and processed foods, like large portion sizes encourage the overeating, sedentary lifestyle reduce the energy expenditures, and marketing and advertising influence the food choices. So there is some health consequences like increased risk of type 2 diabetes, cause the cardiovascular disease and the hypertensions. There is some musculoskeletal problems and psychological effects including the depressions. There is some behavioral interventions like focus on changing the eating and activity behaviors like promote the sustainable lifestyle changes, non-invasive and cost-effective and often used alongside medical treatments. There is some self-monitoring process like tracking the food intake, increase the awareness, monitoring the physical activity, encourage the consistency, identifies the patterns and triggers, and associate with the better weight loss outcomes. So there is some goal setting like setting realistic and achievable goals. Short term and long term goals improve the motivations. Some SMART goals can enhance the adherence and progress the tracking reinforce success. There is some stimulus control like reducing the exposures to unhealthy food cores, planning meals in advance, creating the supportive environments and limiting the emotional eating triggers. There is a cognitive behavior therapy which we call the CBT. It addresses the dysfunctional thoughts about the food, improve the coping strategies, reduce the binge and emotional eating, and enhance the long-term behavior changes. So there is the relationship between the thoughts, emotion, behavior, and physical reaction. So in any situation, what trigger the problem, criticize at work, then thought what goes through my head, I am not good enough. So it creates the emotion, how do I feel worthless and anxious? The behavior, what do I do, avoid contact with the other, and the physical reaction, how does my body react? So it feel tired, loss of the appetite. There is some lifestyle modification like adopting the balanced and nutritional diet, increasing the daily physical activities, managing the stress effectively, and ensuring the adequate sleep. So there is the role of the support system like family support improve the adherence, group programs increase the motivations, healthcare professionals provide the guidance, and the technology support the self monitoring. So, what is the effectiveness of behavior interventions? Produce modest but sustainable weight loss. It can improve the metabolic health, having the more effective than the diet plan, and have best result with personalized approaches. So there is some challenges and limitations like weight regain is very much common. Long term adherence is very much difficult, so the environmental barriers persist for a longer period of the time and it requires the continuous support. So, as a concluding marks, obesity is a complex multifactorial conditions. There is some biological and behavior factors which interact with the obesity. The behavior interventions are very much essential to control it. Some long term lifestyle changes can improve their outcome. So, this is all about the effectiveness of the behavior interventions in obesity and some challenges and limitations to control their behavior in the daily life. Thank you so much.